So I guess it's true what they say about stress and worry, and you're giving me gray hairs. And I got it because I never believed my grandma. I was like, that's scientifically impossible for me to give you gray hairs, Grandma. Well, guess what? It's true. Like so many things our elders say, it's true. Let's keep in the KUAM News Zoom room and bring on Margaret Hattori, who's the Dean of Nursing at the University of Guam. And that doesn't even begin to describe all the things that she did and was kind of in charge of during this pandemic, right, Bree?
Yes. Good morning.
Morning. Thank you, guys. I love Dr. Lombard. The guy's a genius. Thank you for always giving him a forum to talk and spread his intelligence.
Right.
We've always needed that.
Yeah. I always felt like he wasn't like a wacko, right? And he wasn't he definitely was not like surgically attached to the administration's behind. So we definitely valued his perspective. Even if he didn't bring any charts, And then it's kind of hard.
I'm glad you guys have a sense of humor because, oh my God, this whole week, I know you've been going down memory lane and, on Facebook, some of us have been avoiding those unhappy memories, right? From a year ago.
Yeah.
It's just hard to believe that, this ends that whole first week of our state of emergency, right?
Yeah, and I mean, I'm not really an optimist, as I'm sure you guys know, but it is kind of crazy to think that 1 year later that we're looking at vaccinating, half of our population, and I just really, we're so blessed as a community, and we've seen it time and time again, disaster after disaster. There's the people of Guam, when we know what we have to do, we don't ask questions, we just get in there and do it. And so that's one of the things I kind of have a hard time just wrapping my mind around, Margaret, is looking back at all the pain and suffering of the last year and kind of seeing where we're at now, right? And it's just such a stark contrast from, we've had you on, you shed a lot of tears on this show. I cried, Bree cried, and what's it like to kind of sit here where we're at now and look back at those dark days?
Well, of course, I feel for a lot of our nurses and other healthcare workers because we've come a long way, but we're, technically because it's a state of emergency, right? All government nurses are still under control of, where we still feel obligated by our duty as public servants. And we're still technically, activated in the COVID response. So it's not like we've had a break or, I just feel for like Margarita Gay, one of my best colleagues, best friends, you've had her on many times, Lillian Posadas, all those nurses, GMH, GRMC, and Ruth Gurusamy, HSP, we're still in the thick of it. They're doing homebound vaccinations. We're still taking care of people that are sick from other conditions besides COVID. We worry about other things like tuberculosis, right? That didn't go away, diabetes. So not to be a Debbie Downer, but yeah, we just, you kind of feel like we're so happy about the vaccination numbers, and Dr. Lombard's correct compared to Japan and, our regions close by, we're doing very, very well. But there's still a long way to go. And for those of us trying to work out details, like, at the end of the month, you guys had me on about the temporary nursing assistants, and God bless them. They're still working at GMH, GRMC, and HSP and doing very, very well. And we threw these people out there to be a temporary nursing assistant to help in the pandemic in November. And now we're bringing them back next month to finish their nursing assistant program so they can be eligible to become full-fledged nursing assistants, take the board exam and pass and everything. So they'll have a career in healthcare. But just figuring out, how to do that safely, do I have a room big enough? And then bringing students back in the fall. It's just like there's so many details that still have to be worked through, which, God bless John Fernandez and Juan Flores, Mary Okada. We're all in that same boat of trying to figure it out and how to be safe. So I guess it's kind of a bittersweet week. Of course, I'm not gonna cry today. Just kidding. I was crying earlier. Then I saw your text. I'm like, I haven't cried in a long time. I think I've been feeling really positive and upbeat. I think the most positive thing about this is that it tested the resilience of our already weak healthcare system and social service system. And I have seen the growth of the leadership and the commitment, right? I mean, I think no one on Guam can doubt the commitment of the mayors and their staff, the commitment of the nurses. We can't say, oh, those GMH nurses, they're not doing a good job. They're doing a great job, right? I mean, a whole new set of heroes, and they don't want to hear that word. Nobody really wants to be called a hero, but it's true. They've risen up through all of this pain and suffering, and they keep moving ahead. So I just want to say, anybody that knows someone that's, we've all been in this struggling, but those that are in healthcare and social services that can't take a vacation or can't take a break, give them a hug today if you can. I mean, if you're vaccinated and you're related and you live in the same household, just teasing. But man, I think this is the week those people, could use some extra loving and some extra care because, it's not over. Sorry. And we just have to keep moving ahead and get vaccinated. Sorry. I apologize.
No need to apologize, Doc.
I'm very positive though. I got to tell you, the flooding of the memories, I think, is happening for a lot of people this week. But I'm just so proud of Guam. Yesterday, on a great note, I was invited to present at the University of the Ryukyus. And of course, I'm thinking, what am I going to present? What do I know, right? And so luckily I was last, and I presented about Guam's, how we've dealt with the homeless situation, which thanks to the governor, lieutenant governor, and public health, we've been able to maintain, very, very, very low numbers in the homeless population, which, we all feared and you guys advocated for early on in the pandemic. So there's a lot of successes, and I shared our vaccination rates, showed them some pictures of the field house, the public health nurses doing their pods in the villages like Agate, Manila this week. But anyway, I was the last one, and I was so shocked because the person in charge, who's in charge of global health at the University of the Ryukyus, made several comments and said, Guam is way ahead. And he said, there's a lot we can learn from Guam. And I just got to say to people, stop thinking that we can't do it. Stop thinking that we're less than our mainland friends. People on Guam, we kick butt. We have the best support network, the best media that supports us. Our government is trying to do the best they can with the limited resources. Who knew in a global environment that we would be out there saying, here's our vaccination rate, or someone else saying, wow, you guys are just great. So, hats off to public health, the hospitals, HSP, the National Guard, of course. I love those guys. They're my latest heroes, right? Want to hug all of them. But yeah, thank you for giving me this forum and this opportunity to just thank the people of Guam for supporting us and doing their part, because it has been difficult for everybody, which but thank you guys.
No, thank you. I wish I could hug you too.
Yeah.
I'm okay now. My momentary lapse of strength is over. I'm just so got to be proud of Guam and proud of our people.
Yeah.
And let's keep moving forward, right? And those young ones, those 40-year-olds, get vaccinated.
Right on. Okay. Margaret, thank you. I know it's last minute. I don't know if it's just this show, there's something in the water here, but every time you come on, there's always tears that are shed. So
yeah, sorry about that.
No, don't be sorry about it. That's fine.
Think of them as tears of pride right now for our island.
Yeah.
And love for the people who continue to suffer, and just know that there are people out there that care. So it's great to be proud of our island and proud of all of our efforts. So thank you guys. Thanks for being able to say that. I
just want to recognize you and your advocacy, not just for the those who have suffered from COVID and just many sick people in our community, but also your advocacy for the homeless, because I really feel like it was you. Even before the pandemic, you and just kind of really pushing this this information. And with the homeless issue, for so many years, it was just something that we would just turn. It's uncomfortable to look at. I don't want to see it, and you guys really kind of helped bring it out to the forefront. And I mean, that is one of the COVID silver linings. We stood up a homeless shelter, so, and I think a lot of it is because you really kept people's feet to the fire. So good job.
Yeah, well, I don't know that. I'm just a tiny part of the whole picture, right? Can't do it without everybody else. So yeah, no. And you guys are a big part of that as well, especially the Lieutenant Governor's Interagency Council on Homelessness and Poverty Prevention. And Mayor Hoffman is leading that charge with the Lieutenant Governor. So, shout out to them. But no, I'm just a tiny part of the little, this big wheel that has to keep moving ahead. But thanks, guys. Happy Friday.
Well, Margaret, the big picture is nothing without the details. So even the tiniest little cog makes the machine run smooth.
Are you? Yeah. Thanks.
Thank you, Margaret.
You. Sorry.
Okay.
That's bye.
Right on.
Bye.
A day. Wow. That's Margaret Hattori-Uchima. What just really, I knew her before the pandemic. You know how Guam is, right? You just kind of run around, especially in the media. You meet people. But I really felt like, even though it's so strange how we really grew together with a lot of people during this pandemic, even though we weren't seeing them in person, right?
Mm-hmm. Yeah.
Yes, Jason.
You know what's most amazing about Dr. Margaret, too, is Bree actually, spotlit like a contribution that she's made to our community where, she's the dean of the UOG School of Health, right? So she's doing, all the stuff. And, like as we profiled in our UOG series, that school actually has 3 components. It's social workers, nutrition and dietary specialists, and the nursing school. And so in her spare time, and I use that in air quotes because there's very little of it, she would actually just walk over to the field house when they started doing the community test centers. And she's like, hey, I'm going to glove up, I'm going to gown up, I'm going to mask up, and I'm going to jump in and help distribute vaccination. She's a rock star.
Yeah. And not only that, Tyler actually did the interview with her and how she spends her lunch and free time over at the UOG vaccination clinic. But then she went back to do another interview, and then she interviewed her daughter, who also goes over and volunteers.
No, and I believe when I interviewed her for the UOG thing, I said, how's your daughter doing, and is she on track? And she said her daughter is really working to get out into, professional nursing as quickly as possible. She's doubling up classes, and she really wants to, just get in the fight. And you can really see from, Margaret's character where that comes from.
It's 8:03. Guys, we're KUAM-FM in Agotnia, Guam on the radio side. It's just one part of our multimedia broadcast. Again, we've got a KUAM News Facebook Live, and we're on the radio here on the Breeze 93.9. To our viewers in KUAM TV, jump over on the show. We're going in with public health, and we got the senators to talk about some of these expenditures that we were discussing yesterday. My name's Chris.
I'm Serena.
Está adios. And we are back. We're going to take a quick break and come back with more of the link next right here on the Breeze 93.9 on the radio. Of course, we're live Facebook, KUAM News. Good morning. It's 8:00.